Hi, this is Eric Hanyak with Altitude Physical Therapy in Boulder, Colorado. We're trying to briefly answer some questions that we get all the time in our physical therapy clinic from our patients. Today's question is, what exactly is tennis elbow? Tennis elbow, also called lateral epicondylitis, is a painful condition that occurs when the tendons in your elbow are overloaded, usually by repetitive motions of the wrist and arm. Tennis players are not the only ones who develop tennis elbow, but it's named for tennis elbow because of the motion in tennis of doing multiple backhanded activities where you have to really load this muscle and tendon, which over time will create a lot of tension at where the tendons insert on the bone. People who also commonly get tennis elbow include plumbers, painters, and carpenters, people who use the forearm muscles a lot. In the clinic here in Boulder, we typically see tennis elbow a lot in rock climbers, and sometimes after a big snowstorm that requires a lot of shoveling, and people will come in just from having excessively shoveled. The pain of tennis elbow occurs primarily where the tendons of your forearm attach to the bony bump on the outside of your elbow. The pain can also spread into the forearm, sometimes to the wrist, and pain can come on with as little as just holding a cup or shaking someone's hand. Rest and over the counter pain relievers often help to relieve tennis elbow. In cases where rest does not resolve the pain, specific exercises can be given to help the recovery. Typically, the eccentric exercise with weights or a resistance rod can do the trick to help get you over this. I'm just going to demonstrate with a weight here what an eccentric exercise looks like. You would help lift the hand up and lift the weight up, and then slowly lower that weight. So we're putting an eccentric load on this muscle and tendon. And that kind of slow strengthening has been shown to really help tendons recover when they're injured. Additionally, patients may benefit from manual therapy like massage work to loosen up these muscles, dry needling, again, to loosen up the forearm muscles, or an iontophoresis treatment, which drives dexamethasone, a topical corticosteroid, to just calm down the inflammation in that area, all of which can be done in a PT clinic. Thanks for listening. I hope this was helpful, helping you learn about lateral epicondylitis.